Good afternoon, everyone. My name is Kimberly McNeil, and I'm the Director of Screening at the Colorectal Cancer Alliance. I'd like to welcome you all to part three of our Health Equity webinar series entitled Breaking Barriers, Resources, and Financial Assistance. As many of you know, healthcare costs are extremely expensive, and many struggle from day to day just to find a way to pay for necessary medication. Financial insecurity is very real, and it's imperative that we find ways to provide resources to those individuals who need them the most. Here to provide a comprehensive presentation, I am honored to present to you Amy Niles from the PAN Foundation. Amy Niles is a knowledgeable healthcare executive with a passion for growing sustainable health organizations, advocating for patients, and building strategic partnerships to address public health needs. As PAN's Chief Mission Officer, she leads the organization's education initiatives, program development, clinical affairs, and advocacy strategy while overseeing public policy and advocacy initiatives, external relations, and marketing and communications. She developed the framework for PAN's national advocacy platform in 2013 and has been leading the initiative ever since. As a result of her leadership and proactive analysis of the legislative regulatory environment, external stakeholders and policymakers have come to view PAN as a thought leader and go to resource. She has been quoted in the New York Times, Time, and HuffPost, and she has authored and co authored numerous opinion pieces and articles about Medicare reform and affordability. Amy believes that no one with a serious illness should have to worry about how to access and afford treatment. She is motivated every day by the knowledge that she is working to fill gaps in the nation's healthcare system to support vulnerable populations one person at a time. She has previously helped lead successful startups and growth initiatives, including the Together RX Access program. She co founded, developed, and served as president and CEO of the National Women's Health Resource Center, which grew into National Clearinghouse for Women's Health Information under her leadership. Amy has more than 30 years of experience in health nonprofit leadership, including strategy, external relations, and board governance. But her colleagues are most impressed by the way she leads with heart and her dedication to every person PAN serves. She holds a master's of business administration from Bard College, City University of New York, and an undergraduate degree in biology from the University of Rochester. Amy also serves on the board of the Specialty Pharmacy Certification and Unincorporated Division with the National Association of Specialty Pharmacy and is a member of the Center for Value-Based Insurance Design's Advisory Board. Please help me welcome Amy Niles.
Thank you so much, Kimberly, for that very, very warm welcome. And I want to extend a heartfelt appreciation to the Colorectal Cancer Alliance. We appreciate having the opportunity to present to all of you today, and we have so valued our very strong partnership with your organization over many years. So we do appreciate being with all of you today. We have a lot to cover today. If you go to the next slide, I am so humbled to be here with my colleague and partner in crime, James Ridley. Dr. Ridley is PAN Foundation's Director of Clinical Affairs, and I when it comes time for his slides, I know he will share a little bit more about his expertise. But James, thank you for being with me today. We have a lot to cover. In a short period of time today, we're going to talk about the challenges, and there are many, that patients face accessing the treatment and the care they need. We'll talk a little bit also about the range of financial assistance programs that are out there. And of course, we're going to do a deep dive into the PAN Foundation, talking about our range of services that we provide. But the challenges are many. I probably don't have to spend too much time on this slide because perhaps all of you feel some of these challenges every single day. We are all facing high out of pocket. If you go back one slide, James, if we in accessing the health care that we need, we experience every single day high out-of-pocket costs for prescription medications, for physician services, for procedures. We oftentimes face barriers that get presented to us through our healthcare plans, things like prior authorization, step therapy. We know that people who are living with chronic conditions have very low awareness about the range of resources that may be available to them, and we'll touch on some national polling that we recently conducted about just this topic. And we know that social drivers of health impact the majority of health outcomes today. And certainly, we are seeing this year more than ever a rapidly changing landscape that today, next year, years to come, may negatively impact millions of Americans, impacting how they access the care they need. Next slide. So at the PAN Foundation, we have an initiative called the State of Patient Access, and I thought this was a really good way to ground our conversation today. We go out and poll adults living with chronic conditions across the nation. And we ask them many, many questions and have come up with a rigorous methodology to create a scorecard. And what the scorecard really speaks to is how people across the country rate access to care in the United States. And as you can see here overall, adults living with chronic conditions don't rate access to care with high marks. They give it an overall rating of C. But I want to point your attention to the two items at the bottom: access to treatment through healthcare plans. These were all the barriers that I just recently spoke about, presented by healthcare plans. People give healthcare plans a rating of D minus. And financial toxicity, the financial impacts that are experienced when individuals are living with chronic conditions, a D plus. People are concerned about their costs, and we know that millions have significant medical debt. Next slide. So a little bit, and one more, a little bit about the financial assistance landscape. We won't spend a whole lot of time on today's webinar reviewing all of these types of programs, but I'm presenting this to you today to just let you know that there are many different types of financial assistance programs that could be available to you depending on your situation, depending on your insurance status. So, for example, we know that pharmaceutical manufacturers often have their own patient assistance programs for people who are uninsured or commercially insured. We know that the federal government operates a very important program called Extra Help, or the Low Income Subsidy Program, which helps people pay for their out-of-pocket costs, especially people with very low income. And then, of course, organizations like the PAN Foundation operate programs mostly for people who are underinsured. Next slide. We'll spend a little bit of time today talking about a very important web application called Fund Finder that the PAN Foundation created several years ago. James will talk about that. And then there are more programs: state pharmaceutical assistance programs, Medicare savings programs, the AIDS drug assistance program, that are also available to help people with low income access the treatment they need. Next slide. And one more. So our mission at the PAN Foundation is to accelerate access to affordable, equitable healthcare through financial assistance, education, and advocacy. And at PAN, we call these our three pillars: financial assistance, advocacy, and education. Next slide. James is going to go into quite a bit of detail about our financial assistance programs, and we have many that help people afford their medication copays and coinsurance premiums, as well as transportation. And then I'm going to provide a high-level overview of all that we do in our advocacy and education pillars. Next slide. So just to touch on the patient population that we serve, over the last 21 years, since 2004, when we were established, we have helped more than 1.3 million people access the care they need. That has equated to more than $4.5 billion in financial assistance. And every single year, we are helping people afford their care in every single state and every single territory in the United States. Next slide. So with that, I'll turn it over to my colleague.
Thank you, Amy. It is so good to be here today. My name is James Ridley. As Amy mentioned, I am the Director of Clinical Affairs here at the PAN Foundation. I actually oversee the work that I'm about to talk about now in regards to our financial assistance and our disease funds. So currently here at PAN, we have over 80 plus disease funds. And through those funds, we help patients pay for the copay assistance, the out-of-pocket costs for their medications, premium assistance to help with the health insurance premiums, and also transportation assistance. I always like to highlight here is that the unique thing here about PAN is that a patient actually can be enrolled in all three of these funds if it is available for that particular disease state. One thing to highlight is that a patient has to be enrolled in either a copay or a premium, and then they're eligible to apply for our transportation assistance. So currently we cover prescription medications that are listed on our formularies or our medication list for the specific disease states that we offer assistance for. And through that formulary, it includes all medications that are FDA approved, guideline listed, and also compendia listed. We do not cover medical services, office visits, or lab work. Nor do we cover medications that are not covered by the insurance. We are the last payer of resort. So a patient submits their insurance information, and whatever that copay is, we take care of the copay for that patient. And then also, we do not cover products that are billed through discount cards. So our transportation assistance program, we realize there are many barriers to accessing care. There are many barriers in regards to SDOH. And what we hear all the time, that transportation is a huge barrier for patients getting to and from their appointments, going to grocery stores, going to receive social support. So here at the PAN Foundation, we offer patients a $500 prepaid card where they can use to submit payments for either gas or the transportation, tolls, etc. And through our transportation assistance, we've helped over 8,000 patients, providing that assistance to them. So let me go a little bit deep into how our financial assistance work here at PAN. So we have what we call disease funds. And as Amy mentioned earlier in regards to resources, pharmaceutical companies have what they call drug copay cards. And essentially with that drug, they help with the out-of-pocket costs for that those medications. The pharmaceutical companies, they're able to help commercial insured patients and also uninsured patients. Through charitable organizations such as the PAN Foundation, we are able to help patients who have federally and government insured. For example, Medicare, Medicaid, TRICARE, all insurances through the marketplace. So we're able to help all those patients. And through our disease funds, we have an eligibility requirement for each of them. Some things that are consistent is that a patient must be being treated for the disease, named in the assisted program. They must reside in the U.S. and receive treatment here in the U.S., but citizenship is not required. They also must have the specified health insurance to qualify for that particular disease state. And then also, as I mentioned, the medications that are on the list, they must be taking one of those medications, and they must fall at or below the federal poverty level. With the federal poverty level, our funds range between 400 and 500%. But I have a chart here that will list out what exactly that income level is per individual and household. So A little bit about our disease fund. So we have assistance amounts for each disease fund, and they vary by fund. And with that assistance amount, once a patient applies and receives our grant, that grant is theirs for 12 months. Through that 12-month period, if they run out of funding with the assistance amounts, we do offer, based on availability, that a patient can request additional funding to cover them to the end of the 12 months. Also, we have a renewal process that at the 11th month, the patient or caregiver or provider can request for funding for the next 12-month period. We know that finding resources can be very challenging for patients. So once a patient receives a grant from us, we also allow a 90-day look back period. And essentially what that is we will cover any reimbursements for that particular medication, for that disease state that is covered under that fund, looking back 90 days, and we'll give a direct reimbursement to that patient. So our disease funds. Here is a chart, and I'll give you a few moments to look. These are all of our current disease funds that we offer here at PAN Foundation. And as I mentioned, we have 3 different types of funding. Copay, those are all the diseases that are listed. And then for our premium assistance, you will see an asterisk beside some of the disease states. And that is indicating we have a premium assistance fund for that particular disease state. And then again, as I mentioned, transportation assistance. So how to apply for the financial assistance. So there's 4 easy steps. 1 is checking if the fund is open. 2 is verifying the patient's eligibility, gathering all the information, and then submitting the patient's application. Once the application is submitted, the patient or provider or caregiver will find out instantly if the patient is approved for that grant. So there are a few ways to check to see if a fund is open. 1, a patient or you can visit our webpage at panfoundation.org under the disease funds and see if the fund is open. Also, we have a PAN portal. You, provider, pharmacy can actually go and create a portal account and start an application online through our portal system. And then also we have a full call center that is open Monday through Friday from 9 to 5:30. With our call center, our patient support staff are able to answer any questions, help with an enrollment process, anything that you may need or any question that you may have, they are there to help assist you. So in verifying the eligibility criteria, again, I mentioned that some of the things that are consistent across our disease fund is that you have to be diagnosed with the disease state. Again, mentioning have to reside and live in the US, the specified health insurance, also the medication and the FPL. And on our webpage, we have an easy tool that you can go in and put the patient's information in regards to the disease state or medication, and it will give a very high level approval for you to let you know if you or your patient is eligible for the disease fund, and then we'll send you on to the application process. So we wanted to highlight, of course, so the PAN Foundation, we have a fund for colorectal cancer. And through that fund, as I mentioned, each disease fund has an assistance amount. So colorectal cancer assistance amounts is $2,000 as the initial grant. Again, highlighting that that grant is given to a patient for a 12-month period. Also highlighting that if that $2,000 is used and funding is available, the patient can request for additional funding totaling up to $4,000 per year. That income level is at the 500 FPL. And then also this fund is for Medicare patients. So if a patient has Medicare, they could be eligible for this particular grant. I would like to highlight that in checking to see if a fund is open or closed, we do have a wait list. And through our wait list, if a fund is closed, I encourage you or your patients, or if you have family members, to have them go and sign up for the wait list. The reason being is once funding becomes available for a fund, the patients are notified that it is open to the wait list. It is the first come, first served basis. And once we get through the wait list of patients, then it will open up to the general public. But we like to make sure that we're able to help our patients who are on the wait list, who are waiting to receive a grant. And again, as I mentioned, this is our federal poverty level, our FPL guideline is just for you to understand. So for example, colorectal cancer is at 500%. For an individual patient, if they are the only one in their household, they can make up to $78,250. And that increases based on household and family size. So again, mentioning gathering all the information, we require the patient's diagnosis and medication. Also, if you are a provider or pharmacy and enrolling on behalf of the patient through our portal, we do require a diagnosis code in the portal. Also, of course, the patient's first name, last name, social, date of birth, address, telephone number, also their provider's information, their income and number of people in household, and then also their health insurance carrier and insurance information. And then submitting the application. As I mentioned earlier, we pride ourselves on making the process as easy as possible for patients and caregivers and providers. Is that as soon as the patient put it in the application, they receive that they are approved, and usually the application process ranges between 5 to 10 minutes, depending on what information is needed for that patient. They can start using their grant immediately. And this, again, once the patient is enrolled, they are approved, they can start submitting reimbursement requests. All right, so I would like to talk about Fund Finder. As Amy mentioned earlier, we created this web-based app a few years ago. And what we realized here at the PAN Foundation is, as a patient, as a caregiver, as an advocate, it can be very time-consuming looking for resources for patients. So what we did is we created a web-based app where we pulled in 9 of all of the charitable organizations similar to PAN. There are a total of 9 of us. And you can go in through this web-based app and search for Disease Fund, and it will give you information in regards to which foundation offers the assistance, which foundation has the fund open so that you can apply. And it also gives you alerts. So if they are all closed, you can sign up for alerts. So as soon as a foundation opens up their funds, you will be notified so that you can go and put in an application. And again, that can be found at Fund Finder online. And on the end of the page, we'll have all the resources that you can use to go and look up this information. And again, as I mentioned in resources, if you would like any resources from us about a one-pager to give to patients, or a list of our disease funds, or a step-by-step process on how to enroll as a healthcare professional or a patient and caregiver, we are more than happy to send these digital resources over to you so that you can use for yourself or to distribute out to the communities in which you serve. All right, and I'm going to pass it back over to you, Amy.
Thanks, James. And just a couple of notes. One is James talked about the funds where we are providing premium assistance. This is a growing area of focus at the PAN Foundation because we know premiums are rising. So we hope to be able to expand services in this area in the future. Want to emphasize again the importance of adding names to the wait list. And also the importance of registering for Fund Finder, because as Mark on that slide noted, without that alert, he might have been without assistance because the fund had closed 30 minutes after he received the alert. So really important tools for all of you. So I'm going to focus a bit on our second pillar at PAN, which is our advocacy pillar. And here we are focused right now at the federal level on improving access to care for all Americans. Next slide. We do this in a lot of traditional ways, like many organizations do. We're meeting with elected officials in Washington, D.C. We're meeting with their staff. We're leading sign-on letters. We are working collaboratively with other organizations and coalitions. But we have many different areas of focus at PAN as it relates to our advocacy pillar, and we divide our areas of focus into these 5 areas: advancing health equity, lowering out-of-pocket costs, reforming Medicare, expanding commercial insurance access, and improving the healthcare system. And while we won't today go into all of the areas that we advocate for, on the next slide, you'll see some of our key areas of focus this year, and I suspect going into 2026 as well. We are very focused on protecting access to care for those on Medicaid. We have seen that there will be Medicaid cuts in 2026 as a result of the One Big Beautiful Bill, and we're concerned about those cuts. We're also concerned about the premium tax credits on the marketplace. We would like to see them extended permanently. We know that is a very hot topic right now. They expire at the end of this year, and unless they are made permanent or extended, we know that millions of people will not be able to afford their care. Expanding telehealth services, streamlining prior authorization step therapy. We know these processes often delay access to care for many Americans. On the commercial side, there are policies that have been put in place by plans and employers called copay accumulators, copay maximizers, alternative funding programs. Again, we won't go into all the details today, but these policies and programs have very negative impacts on patients' access to care. We are also looking forward to the day when at least Medicare will cover anti-obesity medications. And we are very focused through our education work on bolstering clinical trial representation and participation. We think that is critically important. And finally, expanding dental, vision, and hearing services, regardless of one's insurance, is also vitally important to us. Next slide. So I just wanted to spend a moment or two on our Center for Patient Research, which is where we at PAN lead national polling because we're very interested to hear the perspectives and the challenges that people living with serious illness across the nation are experiencing. Next slide, please. Wanted to highlight two recent polls that we did. This first one relating to the extent to which communication between patients and their healthcare providers is happening regarding affordability of treatment. And what we found across the country that at least 1 in 3 patients were not having conversations with their healthcare provider about their inability to afford or access their medication. So we have a lot of work to do. Next slide. And I know this is a very, very busy slide, but if you recall my earlier comments about low awareness of financial assistance programs, without going into all the details here, suffice to say that up to half of the adults that we polled across the country are simply not aware of the range of financial assistance programs that are out there, including charitable foundations like PAN and even the pharmaceutical patient assistance programs. Next slide. Touching on our education focus, what we do at PAN is really focus on those topics that are complex. We're not here, for example, to educate about colorectal cancer. We leave that up to the Colorectal Cancer Alliance. But we do want to educate about the topics that impact people living with chronic conditions regardless of the disease or condition that they are living with. And if you go to the next slide, we see the topics that we spend a lot of time on at the PAN Foundation, educating about clinical trials, the Medicare Part D program and reforms, and I'll spend a little bit of time on that in a couple of slides, the Federal Extra Help Program, and just navigating the range of financial assistance programs, navigating healthcare plans, which is very, very complicated. Next slide. So as one of the last topics that we'll address today, I wanted to touch on the Medicare reforms that went into effect earlier this year, January 1, 2025. Perhaps some of you are familiar with them, but I always take the opportunity to educate patients and healthcare providers about these reforms because they are important. The first one is the Medicare Part D cap, which means that this year, no one on Medicare, and that's traditional Medicare or a Medicare Advantage plan, will spend more than $2,000 out of pocket on their prescription medications. That's a big improvement, especially for people who are living with perhaps multiple chronic conditions and have experienced in the past spending much higher than $2,000 on their medications. In 2026, that cap goes up to $2,100. The Medicare prescription payment plan also went into effect on January 1. And unlike the Medicare Part D cap, which is automatic, this is a voluntary program requiring individuals to opt into this payment plan through their healthcare plans. And what it allows one to do is spread out payments over a 12-month period, the calendar year, making those medications perhaps more affordable. Next slide. So the Medicare prescription payment plan is particularly helpful for individuals who have historically faced more than $2,000 a year in out-of-pocket costs, or maybe they have a one-time fill of $600 or more at the pharmacy counter, or maybe they just simply can't afford to pay for their medications all at once and would prefer to spread them across the calendar year. But it's not for everybody. For example, if someone is eligible for the Federal Extra Help Program, that program will meet one's out-of-pocket costs. It will cover the majority, if not all of those costs. So the individual may not need the Medicare prescription payment plan. And likewise, if someone can get assistance from a charitable foundation like PAN, they may not need to opt into this payment plan. Next slide. The payment plan is not very straightforward. It has nuance. It's a little complicated. And as I just mentioned, it's not for everybody. People should really explore their options first to lower their costs before they decide to opt into the payment plan. Opting into the payment plan is through one's health plan. So now one may be receiving, after they opt in, two bills from their plan, one for their premium and one for their prescription medications. So another important change is that in addition to having to take action to opt in, from that point on, the individuals will be paying their plan directly. They no longer will pay for their prescriptions at the pharmacy counter. That's a big change. Next slide. So we always like to provide some resources for patients. We know that Medicare in general is complicated. It has different parts, Part A, B, C, D. Medicare Advantage can be complicated. So we provide resources that will help people on Medicare, whether it be Medicare.gov or our own Medicare Reforms Education Hub at panfoundation.org. The State Health Insurance Assistance Program is a really important resource. Many people don't know about this resource, but in every state there are what we call SHIP offices, and by contacting them, one can receive free personalized health insurance counseling. This is particularly important right now while it is open enrollment for Medicare, and of course that extends up until December 7th. And the Extra Help program is definitely a program that one should consider if one has very low income and very few assets. Next slide. And that we're coming to the end of our presentation. We really do hope that all of you stay connected with the PAN Foundation. You can subscribe to our newsletter. You can scan the code to make it easy for you to do so. And of course, please stay connected to us on social media. We disseminate a lot of information through our social media channels, panfoundation.org, and our newsletter. And I think that is it. James and I want to thank you again for your time this afternoon. We spent a good amount of time going through a lot of information. And so if you have any questions moving forward, I know Kimberly stands ready to help you, but our emails are here as well if you have questions. And with
Absolutely. We will absolutely put your emails too in the chat in just a moment, but there are a couple of questions in the Q&A. And if anyone has any questions, please feel free to type it up and put it in the Q&A and we'll get to your questions. The first question that we have is if a patient is uninsured and has applied for a sliding fee discount provided by the government at federally qualified health center, will they be able to apply for PAN funding?
James, I'll take it. Right now, our programs, our financial assistance programs are for people who are underinsured, not for uninsured.
Got it. Thank you. And then the next question is also, does PAN benefits cover residents of Puerto Rico and Commonwealth of the United States?
Yes, so we cover all 50 states and U.S. territories. Again, as I mentioned, the patient has to be living and receiving treatment in those 50 states and territories, and they can be eligible for grant. And also, U.S. citizenship is not required.
Thank you. Those were the only two questions we have. We'll give a couple more seconds and see if anybody else has any questions. I'm going to put my email in the chat. If you're shy and you feel like you want to ask a question, but you don't want to do it here, you can always email me and then I will forward it right over to Amy and James. So I'm going to do that real quick.